and help you to get over.
Hi, my name is Camille Nicholas, and today I will talk about euthanasia. So, should euthanasia be legal in all states of America? As we get older, we or some of our loved ones may encounter situations in our lives where we may or may not consider it or resort to using physician-assisted suicide or euthanasia. As an aspiring nurse, I know that I will encounter some cases where my future patients would ask me about considering euthanasia. I have done extensive research on this topic because I'm a firm believer that euthanasia should be legal in all states of America. Some people may say it's murder, but so today I'll talk about why euthanasia is morally justifiable, why it should be legal in all states of America, and who favors the legalization. In the United States, the only states that euthanasia is legal in is Washington, Oregon, Montana, Vermont, and New Mexico. I will start with why euthanasia is morally justifiable. According to Margaret Somerville, a medicine professor at Law McGill University, says that people would accept euthanasia, but only in some circumstances, usually limit its access to people who are terminally ill, in serious unrelievable pain and suffering, and require that euthanasia be used as a last resort. These limitations show these people believe in each case of euthanasia needs moral justification to be ethically acceptable. She also says that some pro-euthanasia advocates have gone further, arguing that respectful people's rights to autonomy and self-determination means competent adults have a right to die at a time of their choosing, and the state has no right to prevent them from doing so. In other words, if euthanasia were legalized, the state has no right to require justification for its use by competent, freely consenting adults. Second, I will talk about why euthanasia should be legal in the United States. According to a study by John F. Scott, a medical doctor who works at a hospice care, many patients with advanced cancer favor policies that would allow them access to both euthanasia and physician-assisted suicide if pain and physical symptoms become intolerable. For patients who would actually make requests for a physician hassling them, however, psychological consideration may be at least as salient as physical symptoms. According to Gerald Bachman's article, a research scientist, supporters of the practice emphasize that relief of suffering, individual autonomy, and the patient's right to be free from paternalistic state intrusion. 11 to 14 advocates who also contend that allowing a small number of assisted suicide under carefully controlled and narrowly restricted conditions is better than acceding to secret and unregulated acts. Lastly, I will talk about who favors the legalization of euthanasia. According to John Bachman's article, in the study we examined attitudes toward euthanasia and physician-assisted suicide in the group that would be most affected by legalization. So mostly patients who are terminally ill, patients who have advanced cancer. 80% of those who receive Hazen deaths in the Netherlands. The goals were to examine patient attitudes towards these practices and investigate the factors that are related to personal interest in receiving physician-assisted suicide. According to his study, also 64% who consider that both euthanasia and physician-assisted suicide are acceptable practices that should be legalized. And then there's 21% reported that both are unacceptable and should not be legalized. And there are 14% who said that euthanasia were uncertain and it should be legalized anyway. So most people agree that euthanasia should be legalized. I have a video. is a patient from Belgium, and she has mental illness, and this is her reason as to why she used euthanasia.
Ik denk dat je nu op dit moment zit jezelf met haar die je wilt.
It's not showing.
Yes. Oh no, don't pause. You see that?
Waarom hetzelfde dan?
Yep.
Is de destructiviteit ook weer serieus toegenomen?
Emily started her application to end her life nearly 2 years ago.
Ik denk dat de meeste, om niet te zeggen eigenlijk alle mensen met een euthanasievraag op basis van psychisch lijden hebben een lang verhaal van psychisch lijden. Dus dat is helemaal verschillend van iemand die een acute depressie doet, bijvoorbeeld naar aanleiding van een rouw. Dat is juist een inschatting van artsen, drie artsen, die met de patiënt bezig zijn. En dan binnen psychiatrie de mogelijkheden zijn oneindig. Medicatie, combinatie van medicatie met ambulante residentiële therapieën kunnen we verder doen. Maar het moet een eerlijke kans zijn om echt weten dat het perspectief kan bieden. En bij sommige mensen hebben we die niet, zoals we dat in sommige kankersituaties ook niet meer hebben. Is dat ook zo bij psychisch lijden? Soms hebben we niet meer, niks meer te bieden.
So today we discuss why euthanasia is morally justifiable, why it should be legal in the United States, and who favors the legal inclusion. So in conclusion, euthanasia should be encouraged to some extent in respect to people's right to autonomy and self-determination, especially for terminally ill patients who are in serious relievable.